University College of Nursing and Health Sciences. I'm Dr. Deanna Summers, Assistant Dean and Director of the Undergraduate Nursing Program. I'm excited for you to begin your journey in nursing at Lewis University. Our faculty are experts in their specialty areas. They maintain their expertise in various ways. All the faculty whom teach lecture are in clinical areas. Some of the nursing faculty are practicing as nurse practitioners or as a staff nurse. A few of our faculty have completed their doctorate in nursing practice or are completing their PhDs. The faculty at Lewis University are passionate nursing educators and are dedicated in assisting you in being a successful nursing student. Our NCLEX pass rates have been 95% or higher over the past 5 years. The NCLEX is the test which we all take after graduation from nursing school, so we're able to practice nursing as a licensed registered nurse. The next thing is, if you want to participate in other activities in nursing school, is we have 3 organizations. The first organization is SNA, or Student Nurses Association. The next one is Men in Nursing, and that's for everyone, but the focus is on men in their career in nursing. And the final organization is Sigma Theta Tau, and Sigma Theta Tau is an honor society of nursing, and it's based on your GPA. Again, welcome to nursing. I am Dr. Deanna Summers, Assistant Dean and Director of the Undergraduate Nursing Program here at Lewis University. I have an open door policy, and please stop by and say hi or let me know how you're doing in nursing school, or if there's any manner I can assist you with. Thank you so much. Wishing you the best.
Nurses are ordinary people like you and me. They study hard, they get certified, and then those same ordinary people spend the rest of their career doing extraordinary things on a regular basis.
You're always there when someone needs you. You work your magic quietly. You're not in it for the glory. The care you give comes naturally.
Well, a couple of years ago I had my first hospital experience. Once you strip down and they put your body on a gurney and people that you never have seen before start putting needles in your arm, you realize that there's no control left here. You put your faith into the hospital.
I was in the hospital for 3 months. The nurses really helped me get through because I was terrified that I was never going to walk again. At night when I was scared, I would cry and they would hold my hand and tell me it was all right. They would sing me songs and tell me stories till I went to sleep. It was really nice.
You take my hand, touch my life when I need you.
I had major surgery. I had a tube going down my throat. Every time I'd swallow, it felt like I was swallowing a razor blade. When my doctor came in, he said that he wanted to leave it at least until the next day. And the nurse that I had, she was a sweetheart. And I gave her, I guess, one of the saddest looks in the world. She walked back out with the doctor. And when she came back in, she says, okay, we're gonna take it out. We're gonna remove it. When she took that tube out, it felt like a burden was lifted off of me. I wanted to give her the biggest hug. She really needs to be praised.
And when a nurse enters a room, people don't realize it, but they have to take everything in. Their eyes are everywhere, looking around, checking. Even if there's a window that's open just a tiny bit, they have to be aware.
I'm a professional firefighter. I'm an EMT also. Nurses do the same type of job that we do. We help and save lives, and nurses do the same thing. They're on the front line of everything. Without the nurses, we don't have anything. We have no communications. This is what it's all about. That's what nurses is all about.
I was 17, junior in high school, playing basketball. I felt a thump, and the guy right next to me basically fell. He had a heart attack. Nobody knew what to do. My friend Mike just ran and got Judy, the school nurse, and she said, okay, everybody get out of my way. And she started doing CPR on him. And he was a huge guy, and this Judy, who's tiny next to him, his chest expanding and contracting, expanding and contracting. About a minute after, he coughed and came back to life. She saved his life. It was amazing.
Unsung hero. And I know it's not easy to walk in your shoes.
Well, my father had been hospitalized at the VA hospital in Virginia. When I knew that his time was coming close, I wasn't able to sleep at night. And I would wake up at 3 o'clock in the morning and I would call the nurse and ask her, when she turned him over, would she just tell him that I loved him. I was so moved by her compassion, because, you know, we were in a technical age of technology and everybody's in a hurry. Nobody has time, they don't want to talk to you. Only one family member can talk, and when you have a lot of questions and you just want to be consoled, she was there for me in a moment that I could not be there myself, because she bridged us together. The kindness, her gentleness, Nurse Sharon, I could never forget her.
The compassion, I think, was only exceeded by the professionalism.
I was struck on the left side of my car. I never thought that I was going to be able to walk. I mean, so many broken bones. The nurse used to tell me all the time, Hector, take one step at a time. She was the one that gave me back that force. She was so supportive that I know that it made a difference in my life.
Unsung hero.
At the age of 23, I was diagnosed with cancer, and my parents and I were extremely upset. The nurses were incredibly knowledgeable, and the information they provided on what to expect was very comforting. They were very empathetic, and they made me realize that I was going to get through this operation, that I was going to survive, and that, in fact, my entire family would get through it as well.
I was in labor for many, many hours, and after trying for many, many hours, this sweet nurse, you know, she just held my hand, she stayed with me the whole time, and she said, you know, I think I'm going to have to, unfortunately, do a C-section. And when I found out I was going to have a C-section, it really made me really upset. She said, don't worry, I'm going to stay with you. And her shift was over. And she was the one who helped me push, and I mean, we tried. And she stayed with me, and she went into the operating room with me. And she was the first person who brought me our daughter, Ashley. I really don't know how I would have done it without her. She is someone who I will never forget my whole life. And I only hope that she realizes that, how much she touched my life.
When I was 16, I found out I had a brain tumor, which was really scary as a 16-year-old. I had a nurse there, obviously in an ICU, and her name was Lisa. She was there. She helped me and told me, the truth about things, and this could happen this way, but she was always so positive and so great about it that she was like, it could, but it's fine. Like, the whatever did come along was going to be okay. I don't know if I could have gotten through that experience as well as I did with less trauma and upset without her. Like, I really think back of it, and I think that I found a friend. She put so much of herself in her job. Yeah, it would have been really hard without her.
Welcome. We are so glad that you chose Lewis for your nursing career. My name is Maureen Moore. I'm the coordinator of retention here at Lewis. My job is to help you be academically successful in the nursing major. We are a LaSallian Christian Brothers school, And our founder, John Baptiste de La Salle, believed that you could touch students' hearts and help them to learn better. So we are going to try and touch your heart while we teach you, and we are going to then realize you are going to go out into the world and touch patients' hearts for the rest of your life. So when we meet today at SOAR, what we are going to do is plan your actual academic career here at Lewis. We're not only going to plan your classes for next semester, but your advisor will go over what your plan is for the entire time you're at Lewis, whether you're joining us as a freshman for 4 years or a transfer for 5 semesters. So it will be an individualized meeting. We'll go over all the academic policies that affect you, either as a freshman or as a transfer student to Lewis. And we will talk about some of the things that are going to help you become academically successful. One of the things we will do with you is we'll talk about the sciences. We've learned over the years that certain things will help you a little bit more if you have your eyes wide open when you go in. So one of the things we suggest that you do is get your textbook for the sciences prior to class so that you can start your readings so you're ready to hit the ground running. The other thing we suggest is that you tape your lectures. So this way you can go back and you can listen to all your lectures over and over again if that's what you need. What we have found helpful is if students buy the study guides with the textbooks. And one of the things that's interesting about study guides is you really want to do that on your own and not as a shared experience with your classmates, because study guides work better if you actually go and seek out all of the questions on your own and answer them. It'll help you remember them. Another thing that's a good tip for lab is you generally will do better if you can find yourself like in anatomy, physiology, some type of coloring book where you can actually look at the muscles, look at the bones, label them over and over again. It helps you get ready for practicals. In addition to that, for the sciences, CASE has online tutoring. So I really do suggest that you do get yourself a tutor if you are struggling in any way. When you get into your nursing courses, I can help set up a nursing tutor for you, and it's usually a senior 2 who's about to graduate, so they understand the curriculum and they understand the struggles that you're going for. Also, I want to recommend to you that you figure out where you're going to study, because one of the things you want to do is set up a study area for yourself so that you don't have distractions, you don't access social media, and you actually spend time with the material as you go along in your studies. The other thing I like to caution you as the coordinator of retention is you really don't want to work too much. One of the things that you'll find about nursing is your nursing classes, like the sciences, actually take a lot of time. So you want to make sure that you have the time to devote to your studies whenever possible. And if you're transitioning from high school, one of the things you might find is you have to spend more time with the books than you maybe had to spend in high school. But that's okay, because you're going for a worthwhile goal. You want to become a nurse. So think about that when you're arranging your employment schedule as you come into us as a freshman nursing student or as a transfer, because we want you to be successful. The other thing is we are going to communicate with you a lot through your Lewis email, so please make sure that you check your Lewis email on a regular basis, because we will be sending you updates. When we meet with you at SOAR, we're going to be asking you if there's any special considerations, and the reason is we assign advisors. All of your advisors here in the College of Nursing are faculty members who will actually teach you when you're in your nursing courses. But we have some specialty advisors too. So we're going to ask you if there's any learning disability or medical concerns, because I will remain your advisor for your entire career. We're going to ask you if you're going to play athletics, because Professor McDaniel will be your advisor for athletics. We're going to ask you if you're going to be an ROTC student, because if you are going to be an ROTC student, Professor Pat Breda will be your advisor. And we're going to ask you if you've been invited to be a scholar here at Lewis, because if you've been invited to be a scholar here at Lewis, Professor Ann McShane will be your advisor. So all of those things are important for you to tell us when we're doing advising with you. And we're also going to give you some handouts that is going to have everything I talked about today to you. And it's also going to talk about the fact that sometime mid-October, you will get an email from the undergraduate department, and it will tell you to go to our specialized College of Nursing Advising website. At that website, you're actually going to be able to then click on your name, you'll see your advisor's name, and you'll be able to schedule an appointment. We like to make sure that you stay connected through the College of Nursing throughout your academic career. So we will continually monitor your academics and help you at your advising appointments. So if there's anything you want us to know, please tell us during your SOAR appointment. And I am so glad you have come to Lewis for Nursing. Welcome to Lewis Nursing.
Hello everyone, welcome. We're so glad that you joined us today for the SOAR program here at Lewis. My name is Julie Sullivan and I'm the assistant to the Assistant Dean of Nursing here at Lewis in the undergraduate department. I just wanted to take some time to introduce myself so you can get familiar with who I am and what my role is here in the nursing department. If you have any questions throughout your college career, I'm always here to answer anything regarding your Castle Branch account, your drug screening process, and also any questions that you might have regarding who your advisor is and the advising process here at Lewis. My door is always open and I'm located in room 236A right next to the undergraduate office. Best of luck to you and I look forward to meeting you all soon. Welcome to Lewis Nursing.